Question 1. When evaluating the impact of patient safety leadership, walk rounds on a healthcare organization's safety culture, which approach best demonstrates a commitment to identifying and addressing systemic issues while fostering staff engagement? Option A. Reviewing incident reports and quality metrics prior to the walk-rounds to identify areas for discussion without direct staff interaction. Option B. Conducting structured interviews with frontline staff to gather specific examples of safety concerns and collaboratively developing action plans based on these insights. Option C. Observing staff workflows and asking open-ended questions about potential safety hazards, followed by a commitment to investigate and report back on findings. Option D. Focusing on the physical environment and equipment checks during walk-round, with minimal direct engagement with clinical staff. The correct answer is B. Conducting structured interviews with frontline staff to gather specific examples of safety concerns and collaboratively developing action plans based on these insights. Explanation. This scenario is professionally challenging because patient safety leadership walk-rounds are a critical tool for identifying systemic safety issues, but their effectiveness hinges on the leadership's ability to foster an environment of trust and psychological safety. Without genuine engagement and a commitment to action, these rounds can become performative, leading to cynicism among frontline staff and missed opportunities for improvement. Careful judgment is required to ensure the rounds are conducted in a way that genuinely supports patient safety and empowers staff. The correct approach involves actively listening to frontline staff, observing processes without judgment, and committing to follow-up actions. This aligns with the core principles of patient safety leadership, which emphasize transparency, accountability, and continuous improvement. Regulatory frameworks, such as those promoted by the U.S. Department of Health and Human Services, HHS, Agency for Healthcare Research and Quality (AHQ), in their patient safety initiatives, underscore the importance of leadership engagement in creating a culture of safety. Ethically, this approach respects the expertise of frontline caregivers and demonstrates a commitment to their well-being and the safety of the patients they serve. An incorrect approach that focuses solely on data collection without engaging staff in dialogue fails to build trust and can be perceived as intrusive or dismissive of staff concerns. This neglects the human element crucial for effective safety improvement and may violate ethical principles of respect for persons. Another incorrect approach that involves making immediate, unverified promises of change can undermine credibility if those promises cannot be kept. This demonstrates a lack of understanding of the complexities of healthcare systems and can lead to disillusionment, violating the ethical principle of fidelity. A third incorrect approach that involves a superficial review of existing protocols without direct staff interaction misses the opportunity to identify real-world deviations and barriers to safe care. This can be seen as a failure to uphold the duty of care to patients by not proactively seeking to understand and mitigate risks. Professionals should employ a decision-making framework that prioritizes genuine engagement, active listening, and a commitment to observable action. This involves understanding the purpose of leadership walk-rounds as a tool for cultural assessment and improvement, not just data gathering. It requires empathy, a non-punitive mindset, and a clear plan for communication and follow-through, ensuring that staff feel heard and valued, which is fundamental to building a robust patient safety culture. Question 2. Quality control measures reveal an increase in medication administration errors related to a specific intravenous antibiotic. As a certified patient safety officer, which of the following approaches would be most appropriate for addressing this issue? Option A. Conduct individual performance reviews for all staff involved in administering the antibiotic to identify and address competency gaps. Option B. Implement a Plan Do Study Act (PDSA) cycle to investigate the root causes, test potential interventions, and evaluate their impact on error rates. Option C. Immediately issue a new policy requiring all nurses to double-check medication dosages before administration, without further investigation. Option D. Rely on anecdotal reports from a few experienced nurses to identify the most likely cause of the errors and implement a single corrective action. The correct answer is B. Implement a Plan Do Study Act (PDSA) cycle to investigate the root causes, test potential interventions, and evaluate their impact on error rates. Explanation. This scenario is professionally challenging because it requires a certified patient safety officer, CPSO, to balance the immediate need for corrective action with the systematic, evidence-based approach mandated by patient safety regulations. The CPSO must avoid knee-jerk reactions that might address symptoms without tackling root causes, thereby risking recurrence of the issue. Careful judgment is required to select a quality improvement methodology that is both effective and compliant with established patient safety frameworks. The correct approach involves utilizing a structured quality improvement methodology, such as Plan Do Study Act (PDSA), to systematically identify the root cause of the medication administration errors, implement a targeted intervention, evaluate its effectiveness, and standardize the improved process. This aligns with the core principles of patient safety, which emphasize continuous learning and improvement through data-driven decision-making. Regulatory frameworks for patient safety, such as those promoted by the Agency for Healthcare Research and Quality, AHQ, in the U.S., advocate for such systematic approaches to reduce preventable harm. The PDSA cycle provides a robust framework for testing changes and ensuring that improvements are sustainable and lead to better patient outcomes, thereby fulfilling the CPSO ethical and professional obligation to protect patients. An incorrect approach would be to immediately implement a broad, unproven policy change without understanding the underlying reasons for the errors. This fails to address the root cause and may introduce new, unforeseen problems, violating the principle of evidence-based practice in patient safety. Another incorrect approach is to focus solely on individual staff performance without investigating systemic factors, such as workflow design, training, or environmental issues. This can lead to a punitive culture rather than a learning one, which is counterproductive to patient safety goals and may not comply with regulations that encourage a systems-based approach to error analysis. Relying on anecdotal evidence or the opinions of a few individuals without rigorous data collection and analysis is also professionally unacceptable, as it deviates from the data-driven decision-making required for effective quality improvement and patient safety. Professionals should employ a decision-making framework that prioritizes a systematic, data-driven approach. This involves first thoroughly investigating the reported errors to understand their context and potential contributing factors. Then, selecting an appropriate quality improvement methodology that allows for hypothesis testing and iterative refinement of interventions. This process should be guided by established patient safety principles and regulatory requirements, ensuring that all actions are evidence-based, ethical, and aimed at achieving sustainable improvements in patient care and safety. Question 3. Compliance review shows that a hospital is planning to implement a new patient scheduling system designed to improve efficiency. Which of the following approaches best ensures patient safety during this transition? Option A. Delegate the entire impact assessment process to the IT department, trusting their expertise to identify all relevant patient safety concerns. Option B. Form a limited impact assessment focusing only on the technical aspects of the system's integration with existing IT infrastructure. Option C. Conduct a comprehensive impact assessment involving frontline staff, IT, and clinical leadership to identify potential risks to patient care, workflow disruptions, and necessary training before full implementation. Option D. Proceed with the implementation of the new system, assuming that efficiency gains will inherently improve patient safety and address any issues as they arise. The correct answer is C. Conduct a comprehensive impact assessment involving frontline staff, IT, and clinical leadership to identify potential risks to patient care, workflow disruptions, and necessary training before full implementation. Explanation. This scenario presents a common challenge in healthcare, implementing significant changes that impact patient care processes and staff workflows. The professional challenge lies in balancing the need for improvement with the potential for disruption, ensuring patient safety remains paramount throughout the transition. A systematic and thorough impact assessment is crucial to identify potential risks, unintended consequences, and necessary resources before the change is fully implemented. This proactive approach allows for mitigation strategies to be developed and communicated effectively, fostering buy-in and minimizing adverse events. The correct approach involves a comprehensive impact assessment that systematically evaluates how the proposed change will affect all relevant aspects of patient care, including clinical workflows, staff roles and responsibilities, technology systems, patient education, and potential safety risks. This assessment should involve input from frontline staff, patient representatives, and relevant subject matter experts. The justification for this approach is rooted in fundamental patient safety principles and regulatory expectations. For instance, under U.S. federal regulations, healthcare organizations are mandated to have systems in place to identify, assess, and mitigate risks to patient safety. The Joint Commission, a leading accrediting body in the U.S., emphasizes the importance of a structured approach to managing change, including a thorough risk assessment, to ensure that changes do not compromise the quality and safety of care. Ethically, a responsible approach dictates that any change must be implemented in a way that prioritizes patient well-being and minimizes harm. An incorrect approach would be to proceed with the change without a formal impact assessment, relying solely on anecdotal evidence or the assumption that the change will be beneficial. This failure to systematically evaluate potential risks could lead to unforeseen adverse events, such as medication errors due to a poorly understood new dispensing system, or delays in patient care due to unaddressed workflow disruptions. Such an approach would violate the ethical obligation to do no harm and would likely fall short of regulatory requirements for proactive risk management. Another incorrect approach would be to conduct a superficial impact assessment that only considers the immediate operational benefits without delving into the broader implications for patient safety and staff competency. For example, focusing solely on cost savings from a new electronic health record module without assessing the training needs of staff or the potential for data entry errors could jeopardize patient care. This limited scope fails to meet the comprehensive risk assessment standards expected by regulatory bodies and accrediting organizations, which require a holistic view of change management. A third incorrect approach would be to delegate the entire impact assessment to a single department or individual without involving a multidisciplinary team. This siloed approach risks overlooking critical perspectives and potential interdependencies. For instance, a change in laboratory testing protocols might be assessed by the lab alone, failing to consider the impact on physician ordering practices, nursing specimen collection, or the hospital's information system. This lack of broad input can lead to incomplete risk identification and inadequate mitigation plans, ultimately compromising patient safety. The professional decision-making process for similar situations should involve a structured framework that begins with clearly defining the proposed change and its objectives. This should be followed by forming a multidisciplinary team to conduct a comprehensive impact assessment, identifying all potential stakeholders and affected processes. The assessment should then systematically evaluate risks, benefits, resource needs, and training requirements. Based on the assessment findings, a detailed implementation plan should be developed, including robust monitoring and evaluation mechanisms to ensure ongoing patient safety and quality of care. Continuous communication and feedback loops with staff and patients are essential throughout the entire change management process. Question 4. Regulatory review indicates a recent adverse event involving a medication error. To optimize the root cause analysis (RCA) process and prevent recurrence, which of the following approaches best aligns with the principles of patient safety and regulatory compliance? Option A. Conduct a comprehensive, multidisciplinary root cause analysis (RCA) to identify underlying system vulnerabilities and develop sustainable corrective actions. Option B. Focus the RCA on identifying the individual responsible for the error and implementing disciplinary action to deter future mistakes. Option C. Immediately implement mandatory retraining for all staff involved in medication administration, assuming the error was due to a knowledge gap. Option D. Expedite the RCA process by implementing a readily apparent solution based on initial reports, without fully investigating all contributing factors. The correct answer is A. Conduct a comprehensive, multidisciplinary root cause analysis (RCA) to identify underlying system vulnerabilities and develop sustainable corrective actions. Explanation: this scenario is professionally challenging because it requires a certified patient safety officer, CPSO, to balance the immediate need for corrective action with the imperative to conduct a thorough, systematic investigation. The pressure to demonstrate rapid improvement can lead to premature conclusions or superficial fixes that fail to address the underlying systemic issues. Careful judgment is required to ensure that the root cause analysis (RCA) process is not compromised by expediency. The correct approach involves a structured, multidisciplinary investigation that seeks to identify the fundamental system failures contributing to the adverse event, rather than focusing solely on individual actions. This aligns with the principles of patient safety, mandated by regulatory frameworks that emphasize learning from errors and preventing recurrence. By systematically gathering data, analyzing contributing factors, and developing sustainable solutions, the organization upholds its ethical and regulatory obligation to provide safe patient care. An approach that focuses solely on retraining staff without investigating the system's role in the error is professionally unacceptable. This fails to address potential systemic issues such as inadequate staffing, flawed protocols, or insufficient equipment, which may have contributed to the adverse event. Such an approach risks a recurrence of the problem because the root causes remain unaddressed, violating the spirit and letter of patient safety regulations that demand comprehensive analysis. Another incorrect approach is to implement a quick fix based on initial assumptions without completing the full RCA. This bypasses the critical steps of data collection, analysis, and validation, leading to solutions that may be ineffective or even introduce new risks. This haste disregards the regulatory requirement for evidence-based interventions and the ethical responsibility to thoroughly understand and mitigate patient harm. Finally, an approach that assigns blame to individuals without a thorough system analysis is also professionally unacceptable. This punitive approach fosters a culture of fear, discouraging reporting of errors, and hindering the learning process essential for patient safety improvement. Regulatory frameworks and ethical guidelines strongly advocate for a non-punitive approach to error analysis, focusing on system vulnerabilities rather than individual culpability. Professionals should employ a decision-making framework that prioritizes the integrity of the RCA process. This involves adhering to established RCA methodologies, ensuring multidisciplinary team involvement, and dedicating sufficient time and resources to thorough investigation. When faced with pressure for rapid resolution, professionals must clearly articulate the importance of a comprehensive RCA to stakeholders, emphasizing that sustainable safety improvements are achieved through understanding root causes, not through superficial or blame-oriented actions. Question 5. Risk assessment procedures indicate that while the organization has implemented a new patient safety reporting system that has received positive initial feedback from senior leadership, there is a need to comprehensively evaluate the overall safety culture to identify areas for improvement. Which of the following approaches would best ensure an accurate and actionable assessment of the organization's safety culture? Option A. Organize a workshop for department managers to discuss their perceived challenges and successes related to patient safety, and use their input as the primary basis for identifying areas requiring improvement in the safety culture. Option B. Rely on the positive feedback from senior leadership regarding the new patient safety reporting system, and assume that its successful implementation reflects a robust safety culture. Proceeding directly to developing new patient safety initiatives based on this assumption. Option C. Conduct a series of focus groups with frontline staff across various departments to gather their experiences and perceptions of the safety reporting system and overall safety practices, supplemented by an analysis of incident report data trends and a review of existing safety policies and procedures. Option D. Initiate a broad survey distributed to all staff, with questions primarily focused on their awareness and usage of the new patient safety reporting system, and use the aggregated results to gauge the overall effectiveness of the safety culture. Correct answer is C. Conduct a series of focus groups with frontline staff across various departments to gather their experiences and perceptions of the safety reporting system and overall safety practices, supplemented by an analysis of incident report data trends and a review of existing safety policies and procedures. Explanation. This scenario is professionally challenging because it requires the Certified Patient Safety Officer, CPSO, to navigate a situation where a perceived positive safety initiative is potentially masking underlying systemic issues. The CPSO must balance the desire to acknowledge and build upon existing efforts with the imperative to conduct a thorough and unbiased assessment of the organization's safety culture. The challenge lies in ensuring that the assessment is not unduly influenced by pre-existing positive perceptions, which could lead to an incomplete or inaccurate understanding of the true state of patient safety. The correct approach involves a multifaceted assessment strategy that combines objective data collection with subjective feedback, ensuring that all levels of the organization are engaged. This approach is right because it aligns with the principles of robust safety culture assessment, which necessitates a comprehensive view. Specifically, it allows for the identification of both strengths and weaknesses, providing a more accurate baseline for improvement initiatives. This aligns with the ethical obligation of the CPSO to promote patient safety through evidence-based practices and continuous improvement, as often mandated by regulatory bodies like the U.S. Department of Health and Human Services, HHS, and its associated patient safety guidelines, which emphasize data-driven decision-making and a systems-based approach to safety, an approach that relies solely on anecdotal evidence and positive feedback from leadership, risks overlooking critical issues reported by frontline staff. This failure to gather diverse perspectives is a significant ethical and regulatory lapse, as it can lead to a skewed understanding of safety culture and hinder the identification of systemic vulnerabilities that could compromise patient care. Such an approach would violate the spirit of patient safety regulations that demand transparency and a commitment to addressing all identified risks, regardless of their source. Another incorrect approach, focusing exclusively on the perceived success of the existing program without independent verification, fails to acknowledge the potential for confirmation bias. This can lead to a superficial assessment that does not uncover the root causes of any remaining safety concerns. Ethically, this is problematic as it prioritizes the appearance of success over the actual well-being of patients. Regulatory frameworks often require organizations to demonstrate a proactive and thorough approach to risk management, which this method would not achieve. Finally, an approach that prioritizes the immediate implementation of new initiatives based on limited data, without a foundational understanding of the current safety culture, is also flawed. This can lead to wasted resources and the implementation of interventions that are not tailored to the organization's specific needs, potentially exacerbating existing problems or creating new ones. This demonstrates a lack of due diligence and a failure to adhere to the systematic, evidence-based approach required for effective patient safety improvement. The professional decision-making process for similar situations should involve 1. Clearly defining the objectives of the safety culture assessment. 2. Identifying and utilizing a range of validated assessment tools and methodologies that capture diverse perspectives. 3. Critically evaluating all collected data, seeking corroboration and identifying discrepancies. 4. Engaging stakeholders at all levels of the organization in a transparent and constructive manner. 5. Basing improvement strategies on a comprehensive and accurate understanding of the safety culture, rather than assumptions or pre-existing biases. Question 6. System analysis indicates a need to enhance the reporting and analysis of near-miss events within a hospital setting to proactively identify systemic vulnerabilities. As a certified patient safety officer, CPSO, which resource would be the most appropriate starting point for developing and implementing a robust near-miss reporting and analysis program? Option A. Utilizing the Patient Safety Network (PSNet) to search for general articles on near-miss reporting. Option B. Accessing the Tools and Toolkits section on the website for specific guidance on developing reporting systems and conducting root cause analyses. Option C. Reviewing the Comparative Effectiveness Research database to find studies on the impact of different reporting systems. Option D. Exploring the Health Literacy section to understand patient communication about safety. The correct answer is A. Utilizing the Patient Safety Network (PSNet) to search for general articles on near-miss reporting. Explanation: Scenario analysis. This scenario is professionally challenging because it requires a certified patient safety officer, CPSO, to navigate the complex landscape of patient safety improvement initiatives, balancing the need for evidence-based practices with the practical constraints of resource allocation and organizational buy-in. The CPSO must critically evaluate available resources and select the most appropriate tools to address a specific safety concern, demonstrating both strategic thinking and a deep understanding of patient safety principles. The challenge lies in moving beyond superficial adoption of resources to genuine, impactful implementation that demonstrably improves patient outcomes. Correct approach analysis. The correct approach involves leveraging the Agency for Healthcare Research and Quality, AHQ's comprehensive suite of evidence-based tools and resources, specifically identifying and utilizing the Tools and Toolkits section of the AHQ website. This approach is correct because ACC is a primary federal agency dedicated to improving the quality and safety of healthcare in the United States. Their resources are rigorously developed, evidence-based, and designed for practical application in healthcare settings. By focusing on the tools and toolkits, the CPSO is directly accessing actionable guidance, implementation strategies, and validated instruments that have been shown to improve patient safety. This aligns with the CPSO responsibility to implement evidence-based practices and utilize reliable sources of information for patient safety initiatives, as implicitly guided by U.S. healthcare regulations and professional standards for patient safety officers. Incorrect approach is analysis. An approach that focuses solely on general internet searches for patient safety best practices, without specific reference to ACC or other validated sources, is professionally unacceptable. This is because general internet searches can yield a wide range of information, much of which may be anecdotal, outdated, or not evidence-based, leading to the adoption of ineffective or even harmful practices. It fails to meet the standard of utilizing reliable, vetted resources. An approach that prioritizes the adoption of the newest, most technologically advanced patient safety software, without first consulting ACC evidence-based toolkits, is also professionally flawed. While technology can be a valuable tool, its effectiveness in improving patient safety is not guaranteed and often depends on the underlying processes and evidence-based strategies it supports. Without an evidence-based foundation, new technology may not address the root causes of safety issues and could represent a misallocation of resources. This approach neglects the foundational requirement for evidence-based practice, an approach that relies exclusively on anecdotal evidence and personal experience from colleagues in other institutions, without cross-referencing with established resources like ACC, is professionally deficient. While peer learning is valuable, anecdotal evidence lacks the rigor of systematic research and validation. Patient safety initiatives must be grounded in evidence to ensure their effectiveness and to avoid perpetuating ineffective or potentially harmful practices. This approach bypasses the systematic evaluation of interventions. Professional reasoning. Professionals should employ a systematic decision-making process that begins with identifying the specific patient safety concern. Next, they should conduct a thorough search for evidence-based resources, prioritizing reputable sources such as government agencies, like ACC in the U.S., professional organizations, and peer-reviewed literature. When evaluating resources, professionals should consider their evidence base, applicability to their specific setting, and the availability of implementation support. The ACC website, with its dedicated Tools and Toolkits section, represents a prime example of such a reliable and actionable resource. Professionals must critically assess the evidence supporting any proposed intervention and ensure it aligns with regulatory requirements and ethical obligations to provide safe patient care. Question 7. The performance metrics show a sustained increase in the number of reported near misses related to medication administration, with data points consistently falling outside the upper control limit on a run chart. As a certified patient safety officer, which of the following approaches would be most appropriate to address this trend? Option A. Instruct the IT department to enhance the electronic health record system's alerts for medication administration to flag all potential errors proactively. Option B. Initiate a mandatory retraining program for all nursing staff on medication administration protocols and immediately implement a double-check system for all high-alert medications. Option C. Convene a multidisciplinary team, including pharmacy, nursing, and quality improvement specialists, to analyze the near-miss data, identify potential contributing factors through root cause analysis, and develop targeted interventions. Option D. Temporarily suspend all non-urgent medication administration to allow for a thorough review of all current medication policies and procedures. The correct answer is B. Initiate a mandatory retraining program for all nursing staff on medication administration protocols and immediately implement a double-check system for all high-alert medications. Explanation. This scenario presents a common challenge for a certified patient safety officer, CPSO, where statistical data indicates a potential deviation from expected patient safety performance, but the root cause is not immediately obvious. The professional challenge lies in interpreting SPC data accurately and translating it into actionable patient safety improvements without causing undue alarm or implementing ineffective interventions. It requires a nuanced understanding of SPC principles and their application within the regulatory framework governing patient safety in the specified jurisdiction. The correct approach involves a thorough investigation of the SBC data, focusing on identifying the specific process or system contributing to the observed variation. This includes understanding control limits, common cause variation, and special cause variation. The CPSO must then engage relevant stakeholders, such as frontline staff and quality improvement teams, to collaboratively determine the root cause of any identified special cause variation. This aligns with regulatory requirements that mandate proactive identification and mitigation of patient safety risks, often emphasizing a systems-based approach to improvement rather than individual blame. Ethical considerations also dictate a fair and evidence-based approach to addressing performance issues. An incorrect approach would be to immediately implement broad punitive measures or make assumptions about the cause of the variation without proper investigation. For example, attributing the variation solely to individual staff performance without exploring systemic factors would be a regulatory and ethical failure. This could lead to staff demoralization, a lack of genuine improvement, and a failure to meet regulatory obligations for a robust patient safety program. Another incorrect approach would be to dismiss the SBC data as insignificant without a systematic review, potentially overlooking a developing patient safety concern and violating the duty to monitor and improve safety. Professionals should employ a decision-making framework that begins with data interpretation, followed by hypothesis generation regarding potential causes, and then systematic investigation and validation of these hypotheses. This iterative process, often guided by quality improvement methodologies, ensures that interventions are targeted, effective, and compliant with patient safety regulations. Question 8. Research into cognitive psychology highlights the prevalence of confirmation bias, where individuals tend to favor information that confirms their existing beliefs. In a healthcare setting, a certified patient safety officer, CPSO, receives a report that a physician, known for a particular treatment preference, may have overlooked critical patient data that contradicted this preference, potentially leading to a suboptimal treatment decision. The CPSO must determine the most appropriate initial course of action to investigate this serious patient safety concern. Option A. Advise the reporting party that the physician's experience likely means they are best placed to make such decisions, and that the concern is likely unfounded without further investigation. Option B. Focus the investigation solely on whether the physician intentionally withheld information, as this would be a clear ethical breach, and disregard any potential for unconscious cognitive influence. Option C. Immediately issue a formal warning to the physician, citing the potential for confirmation bias to have influenced their judgment and recommending mandatory retraining on objective data interpretation. Option D. Initiate a formal investigation by gathering all relevant patient records, interviewing the physician in a non-accusatory manner to understand their thought process, and consulting with a peer reviewer to assess the clinical decision-making against established guidelines. The correct answer is D. Initiate a formal investigation by gathering all relevant patient records, interviewing the physician in a non-accusatory manner to understand their thought process, and consulting with a peer reviewer to assess the clinical decision-making against established guidelines. Explanation. This scenario presents a professional challenge due to the inherent conflict between a healthcare provider's cognitive biases, specifically confirmation bias, and the imperative to ensure patient safety through objective assessment and reporting. The certified patient safety officer, CPSO, must navigate this delicate situation, balancing the need to address potential errors with the importance of maintaining trust and fostering a culture of open reporting. The pressure to act decisively while respecting individual autonomy and avoiding premature judgment requires careful consideration of cognitive psychology principles and their impact on healthcare delivery. The correct approach involves a structured, evidence-based investigation that acknowledges the potential for cognitive bias without immediately assigning blame. This approach prioritizes gathering objective data, reviewing the patient's record thoroughly, and seeking clarification from the involved clinician in a non-confrontational manner. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as well as the regulatory expectation for thorough root cause analysis of adverse events or near misses. By focusing on understanding the contributing factors, including potential cognitive influences, the CPSO can identify systemic issues and implement targeted interventions to prevent future errors, thereby upholding the highest standards of patient safety. An incorrect approach would be to immediately confront the clinician with an accusation based on the initial observation, assuming confirmation bias led to a deliberate oversight. This fails to adhere to due process and can create a defensive environment, hindering open communication and accurate error reporting. Ethically, it violates the principle of justice by prejudging the situation without a fair investigation. Another incorrect approach would be to dismiss the concern entirely without further investigation, assuming the clinician's experience overrides any potential for error. This neglects the regulatory requirement to investigate all reported safety concerns and could lead to patient harm if an actual error occurred. Finally, an approach that focuses solely on the clinician's perceived intent rather than the objective outcome and contributing factors would be flawed. Patient safety is concerned with preventing harm, regardless of intent, and a comprehensive investigation must explore all facets of the event. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge and identify potential cognitive biases at play, both in oneself and others. 2. Prioritize objective data collection and verification. 3. Conduct a thorough, non-punitive investigation, seeking to understand the why behind the event. 4. Engage in open and respectful communication with all involved parties. 5. Focus on system improvements and learning rather than individual blame. 6. Document findings and actions meticulously in accordance with regulatory requirements. Question 9. To address the challenge of a near-miss medication error involving a newly implemented electronic health record (EHR) system, where a nurse inadvertently selected an incorrect dosage due to a confusing interface, what is the most effective error prevention strategy? Option A. Immediately issue a formal warning to the nurse and place them on a performance improvement plan. Option B. Document the near miss in the patient's chart and monitor the nurse's performance more closely. Option C. Conduct a thorough root cause analysis to identify system vulnerabilities in the EHR interface, implement standardized medication reconciliation protocols, and establish a non-punitive reporting system for near misses to inform future system updates. Option D. Retrain the nurse on proper EHR navigation and medication ordering procedures. The correct answer is C. Conduct a thorough root cause analysis to identify system vulnerabilities in the EHR interface, implement standardized medication reconciliation protocols, and establish a non-punitive reporting system for near misses to inform future system updates. Explanation. This scenario presents a common challenge in patient safety, a near-miss event stemming from a system vulnerability. The professional challenge lies in identifying the root cause beyond individual blame and implementing sustainable error prevention strategies that align with regulatory expectations for patient care quality and safety. Careful judgment is required to balance immediate corrective actions with long-term systemic improvements. The correct approach involves a multifaceted strategy that prioritizes system-level interventions and robust reporting mechanisms. This aligns with the core principles of patient safety frameworks, which emphasize proactive identification and mitigation of risks. Specifically, implementing standardized checklists and enhancing communication protocols directly addresses known error-prone situations, such as medication administration. A culture of reporting, encouraged by non-punitive feedback, is crucial for continuous learning and improvement, a cornerstone of regulatory compliance in patient safety. This approach is ethically sound as it prioritizes patient well-being by minimizing future harm and professionally responsible by adhering to best practices in error prevention. An incorrect approach that focuses solely on retraining the individual nurse fails to address the underlying systemic issues that contributed to the near miss. This approach risks repeating the error if the system remains unchanged and can foster a culture of blame, which is counterproductive to patient safety and may violate ethical obligations to create a safe learning environment. Another incorrect approach that involves immediate disciplinary action against the nurse without a thorough root cause analysis is ethically problematic and professionally unsound. This punitive measure ignores the potential for system failures and can discourage reporting of future errors, thereby hindering the organization's ability to learn and improve. It also fails to meet the regulatory expectation of a systematic approach to patient safety. A third incorrect approach that involves simply documenting the near miss without implementing any corrective actions or further investigation is insufficient. While documentation is important, it does not fulfill the obligation to actively prevent future occurrences. This passive approach neglects the proactive measures required by patient safety regulations and ethical standards to ensure the highest possible quality of care. Professionals should employ a systematic decision-making process that begins with a thorough root cause analysis of any adverse event or near miss. This analysis should identify contributing factors at the system, process, and individual levels. Based on this analysis, interventions should be prioritized, focusing on those that offer the greatest potential for error reduction and are sustainable. This process should be guided by established patient safety principles and relevant regulatory requirements, fostering a culture of continuous improvement and accountability. Question 10. Analysis of a proposed lean initiative to reduce patient wait times in an emergency department by implementing a new triage system that categorizes patients based on a simplified risk assessment, potentially bypassing some traditional assessment steps. As a certified patient safety officer, CPSO, which of the following approaches best aligns with regulatory compliance and patient safety principles? Option A. Implement the new triage system immediately to improve patient flow and reduce wait times, assuming the simplified assessment is sufficient for most cases and any safety concerns can be addressed reactively. Option B. Focus on training staff on the new lean methodology for triage, emphasizing speed and efficiency, and rely on their professional judgment to manage any emergent safety issues that arise during the process. Option C. Advocate for the lean initiative to be shelved entirely, as any deviation from established triage protocols, regardless of potential efficiency gains, inherently introduces unacceptable risks to patient safety and regulatory compliance. Option D. Conduct a thorough review of the proposed triage system, mapping its steps against all relevant patient safety regulations and guidelines, and performing a risk assessment to identify potential impacts on patient identification, assessment accuracy, and communication before implementation. The correct answer is A. Implement the new triage system immediately to improve patient flow and reduce wait times, assuming the simplified assessment is sufficient for most cases and any safety concerns can be addressed reactively. Explanation. This scenario presents a professional challenge because it requires a certified patient safety officer, CPSO, to balance the implementation of lean principles aimed at improving efficiency and reducing waste, with strict adherence to regulatory requirements designed to ensure patient safety and quality of care. The CPSO must critically evaluate how proposed lean initiatives align with or potentially conflict with established patient safety standards and legal obligations. Careful judgment is required to ensure that efficiency gains do not inadvertently compromise patient well-being or violate regulatory mandates. The correct approach involves a systematic evaluation of lean initiatives against the specific regulatory framework governing patient safety in the relevant jurisdiction. This means understanding the core tenets of lean, such as value stream mapping, continuous improvement Kaizen, and waste reduction, MUDA, and then assessing how these principles can be applied without undermining patient safety protocols, reporting requirements, or quality standards mandated by regulatory bodies. For instance, if a lean initiative proposes streamlining a medication administration process, the CPSO must ensure that the proposed changes do not introduce new risks, bypass essential checks and balances, or violate regulations concerning medication safety and documentation. The ethical justification lies in the CPSO primary duty to protect patients, which is reinforced by regulatory frameworks that set minimum standards for safe and effective care. An incorrect approach would be to prioritize lean principles solely for the sake of efficiency or cost reduction without a thorough safety assessment. For example, implementing a lean process that reduces the number of required patient handoffs without a robust alternative communication system in place could lead to information gaps and patient harm, violating regulations that mandate clear and continuous communication for patient care. Another incorrect approach would be to adopt lean tools without considering their impact on regulatory compliance. If a lean initiative leads to the elimination of documentation steps that are legally required for patient care continuity or for regulatory reporting, this would be a significant ethical and regulatory failure. Furthermore, focusing solely on eliminating waste, as defined by lean, without considering that some processes deemed wasteful by lean might be essential safety checks or regulatory requirements would be a critical oversight. The professional decision-making process for similar situations should involve a structured risk assessment framework. The CISO should first identify the proposed lean initiative and its intended benefits. Then, they must thoroughly research and understand all applicable patient safety regulations and guidelines. The next step is to analyze the potential impact of the lean initiative on each relevant regulatory requirement, identifying any areas of conflict or potential risk. Mitigation strategies should be developed for any identified risks, ensuring that patient safety and regulatory compliance are maintained or enhanced. This iterative process of assessment, analysis, and mitigation, grounded in regulatory knowledge and ethical responsibility, is crucial for effective patient safety leadership. Question 11. The investigation demonstrates that a medication error occurred due to a breakdown in the handoff process between two nursing units, resulting in a patient receiving an incorrect dosage. The Certified Patient Safety Officer, CPSO, is tasked with determining the most appropriate next steps to ensure patient safety and prevent recurrence, while adhering to U.S. regulatory frameworks and ethical principles of patient care. Which of the following approaches best reflects the required professional response? Option A. Implement a mandatory retraining program for all nurses on medication administration protocols, without a specific analysis of the handoff process breakdown. Option B. Immediately issue a formal reprimand to the nurse who received the patient on the second unit for failing to verify the medication order, and implement a new policy requiring double checks for all medication administrations. Option C. Classify the incident as an unavoidable human error and document it without further investigation, as the patient was not significantly harmed. Option D. Conduct a thorough root cause analysis, RCA, to identify system vulnerabilities in the handoff process, interview all involved staff to understand contributing factors, and develop evidence-based recommendations for process improvement, while ensuring a just culture environment. The correct answer is D. Conduct a thorough root cause analysis, RCA, to identify system vulnerabilities in the handoff process, interview all involved staff to understand contributing factors, and develop evidence-based recommendations for process improvement, while ensuring a just culture environment. Explanation. This scenario presents a professional challenge because the Certified Patient Safety Officer, CPSO, must balance the immediate need to address a critical patient safety incident with the long-term imperative of fostering a culture of open reporting and learning. The CPSO role requires meticulous adherence to regulatory frameworks, such as those governing patient safety and incident reporting in the United States, to ensure compliance and protect patient well-being. The challenge lies in conducting a thorough investigation that identifies root causes without alienating staff or creating an environment of fear, which could lead to underreporting of future incidents. Careful judgment is required to select an investigative approach that is both effective in preventing recurrence and supportive of the organization's safety culture. The correct approach involves a systematic root cause analysis, RCA, that focuses on system vulnerabilities rather than individual blame. This aligns with the principles of just culture, which is implicitly supported by regulatory guidance emphasizing learning from errors. An RCA, as mandated or encouraged by frameworks like the Joint Commission Standards for Accreditation, seeks to understand the underlying factors contributing to an event, such as process flaws, equipment malfunctions, or communication breakdowns. This approach is ethically sound as it prioritizes patient safety by identifying and mitigating systemic risks, and it is regulatorily compliant by adhering to established patient safety investigation protocols. An incorrect approach that focuses solely on disciplinary action against the involved staff member fails to address the systemic issues that likely contributed to the incident. This approach violates the principles of just culture and can lead to a culture of fear and underreporting, which is detrimental to patient safety and contravenes the spirit of regulatory requirements that promote learning from adverse events. Another incorrect approach that involves immediately implementing a punitive policy change without a thorough investigation risks addressing the wrong problem or creating unintended negative consequences. Regulatory frameworks emphasize evidence-based decision-making and a systematic approach to safety improvements, not reactive, unsubstantiated changes. This approach neglects the critical step of understanding the why behind the incident. A third incorrect approach that involves dismissing the incident as an unavoidable human error without further analysis is a failure to meet the core responsibilities of a CPSO. Regulatory bodies expect a proactive and thorough investigation of all significant patient safety events to identify opportunities for improvement. This approach abdicates the responsibility to learn from the incident and prevent future occurrences, thereby failing to uphold patient safety standards. The professional reasoning process for similar situations should involve a structured approach. First, ensure immediate patient safety is addressed. Second, initiate a formal investigation process, typically an RCA, adhering to organizational policies and relevant U.S. regulatory guidelines, e.g., those from CMS or the Joint Commission. Third, gather data objectively, interviewing involved parties in a non-punitive manner. Fourth, analyze the data to identify root causes and contributing factors. Fifth, develop and implement evidence-based recommendations for system improvement. And finally, monitor the effectiveness of implemented changes. This process prioritizes learning, accountability within a just culture framework, and continuous improvement in patient safety. Question 12. During the evaluation of a recent near-miss event involving medication administration errors, which approach best demonstrates the application of foundational safety science concepts for impact assessment of proposed interventions? Option A, focusing solely on retraining staff on existing medication administration protocols. Option B, implementing a new electronic medication reconciliation system immediately to prevent future errors. Option C, relying on the experience of senior nursing staff to identify the most obvious solution to prevent similar errors. Option D, conducting a thorough analysis of the near-miss event to understand contributing factors, then assessing the potential impact of various interventions on patient safety, staff workflow, and organizational culture before selecting and piloting a solution. The correct answer is B, implementing a new electronic medication reconciliation system immediately to prevent future errors. Explanation: this scenario is professionally challenging because it requires a certified patient safety officer, CPSO, to balance the immediate need for system improvement with the potential for unintended consequences that could negatively impact patient care or staff morale. The CPSO must apply foundational safety science concepts, specifically the impact assessment of proposed changes, to ensure that interventions are effective, sustainable, and do not introduce new risks. Careful judgment is required to move beyond superficial fixes and address the root causes of safety events. The correct approach involves a comprehensive impact assessment that considers multiple dimensions of the proposed safety intervention. This includes evaluating its potential effects on patient outcomes, staff workflow, organizational culture, and resource allocation. By systematically analyzing these factors, the CPSO can predict potential benefits and harms, identify necessary mitigation strategies, and ensure the intervention aligns with established patient safety principles and regulatory expectations, such as those outlined by relevant U.S. healthcare regulations, e.g., patient safety provisions within the Affordable Care Act, CMS conditions of participation, and Joint Commission standards. This proactive, multifaceted analysis is crucial for evidence-based decision-making in patient safety. An incorrect approach that focuses solely on the immediate reduction of a specific error type fails to consider the broader system. This could lead to a whack-a-mole effect, where addressing one issue inadvertently creates or exacerbates another, potentially introducing new patient safety risks or disrupting essential care processes. This approach neglects the interconnectedness of healthcare systems, a core tenet of safety science, and may violate regulatory requirements for comprehensive safety management. Another incorrect approach that prioritizes rapid implementation without thorough evaluation risks introducing changes that are not evidence-based or are poorly designed. This can lead to wasted resources, staff frustration, and a lack of sustained improvement, ultimately failing to enhance patient safety and potentially contravening the organizational duty of care and regulatory mandates for effective quality improvement. A further incorrect approach that relies on anecdotal evidence or personal opinion rather than systematic data analysis and impact assessment is professionally unsound. This bypasses the rigorous, data-driven methodology expected of a CPSO and can lead to ineffective or even harmful interventions. It fails to meet the ethical obligation to base patient safety decisions on sound evidence and best practices, and may not align with regulatory expectations for quality assurance and patient safety programs. The professional decision-making process for similar situations should involve a structured approach. First, clearly define the safety issue and its contributing factors. Second, brainstorm potential interventions, drawing on safety science principles. Third, conduct a thorough impact assessment for each viable intervention, considering its effects on patients, staff, processes, and the organization. Fourth, select the intervention with the most favorable predicted impact and lowest risk of unintended consequences, developing a robust implementation and monitoring plan. Finally, continuously evaluate the effectiveness of the implemented intervention and make adjustments as needed. Question 13. The evaluation methodology shows that during a sudden, unexpected surge in patient volume due to a regional disaster, the on-call patient safety officer is faced with a critical decision regarding the allocation of limited specialized equipment. The officer has received conflicting advice from the most senior physician on duty, who advocates for immediate, direct use of the equipment based on their clinical intuition, and from the hospital's Emergency Preparedness Committee's guidelines, which suggest a more structured, multi-departmental triage process for such resources, which approach best aligns with the principles of crisis resource management and patient safety regulations in the United States. Option A. Delay any decision until a comprehensive review of all available patient data and historical resource utilization patterns can be completed to ensure the most statistically optimal allocation. Option B. Prioritize the senior physician's immediate directive to use the equipment, as their clinical experience is invaluable in a rapidly evolving crisis. Option C. Immediately implement the multi-departmental triage process outlined by the Emergency Preparedness Committee, ensuring all relevant departments are consulted and the allocation adheres to pre-established criteria for equitable and effective resource distribution. Option D. Focus on documenting the decision-making process to protect the hospital from potential litigation, even if it means a slight delay in equipment deployment. The correct answer is C. Immediately implement the multi-departmental triage process outlined by the Emergency Preparedness Committee, ensuring all relevant departments are consulted, and the allocation adheres to pre-established criteria for equitable and effective resource distribution. Explanation. This scenario is professionally challenging because it requires a patient safety officer to make a critical decision under pressure with incomplete information, balancing immediate patient needs against established protocols and potential long-term consequences. The core of the challenge lies in the tension between the urgency of a crisis and the need for systematic, evidence-based decision-making to ensure patient safety and maintain organizational integrity. Careful judgment is required to avoid hasty actions that could inadvertently harm patients or compromise the safety culture. The correct approach involves a structured, multidisciplinary team-based decision-making process that prioritizes patient safety while adhering to established crisis protocols. This approach is right because it leverages collective expertise, ensures all critical aspects of the situation are considered, and promotes accountability. Specifically, in the context of U.S. healthcare regulations and patient safety guidelines, this aligns with the principles of the Patient Safety and Quality Improvement Act, PSQIA, and the Joint Commission Standards for Leadership and Patient Safety. PSQIA encourages the reporting and analysis of patient safety events without fear of discovery and litigation, fostering a culture of learning. The Joint Commission mandates that healthcare organizations have robust systems for managing patient safety, including protocols for crisis situations and interdisciplinary collaboration. This approach ensures that decisions are not made in isolation, but are informed by diverse perspectives, leading to more effective and safer outcomes. An incorrect approach that relies solely on the most senior clinician's immediate judgment, without broader consultation or adherence to established protocols, fails to meet regulatory expectations for comprehensive patient safety management. This bypasses the systematic review and risk assessment mandated by patient safety frameworks, potentially overlooking critical factors or alternative solutions. Such an approach risks violating the spirit of PSQIA by not fostering a system-wide learning environment and could be seen as a failure to implement robust patient safety processes as required by accrediting bodies like the Joint Commission. Another incorrect approach that involves delaying action to gather extensive, potentially unavailable, data before making any decision is also professionally unacceptable. While data is important in a crisis, prolonged indecision can lead to patient harm. This approach neglects the ethical imperative to act when necessary and fails to align with crisis management principles that emphasize timely, albeit informed, decision-making. It also contradicts the proactive risk management expected of patient safety officers, who must be prepared to make critical judgments even with imperfect information. A third incorrect approach that focuses on minimizing immediate liability rather than prioritizing patient well-being is ethically and regulatorily unsound. Patient safety frameworks, including those under U.S. law and accreditation standards, unequivocally place patient well-being as the paramount concern. Decisions driven by liability concerns rather than patient safety can lead to suboptimal care and undermine the trust essential for a strong safety culture. This approach directly contravenes the ethical obligations of healthcare professionals and the core mission of patient safety initiatives. The professional reasoning process for similar situations should involve activating predefined crisis management protocols, convening a multidisciplinary team including relevant clinical experts, patient safety officers, and administrators, and utilizing a structured decision-making framework that assesses risks, evaluates options based on evidence and established guidelines, and clearly defines roles and responsibilities. This process should be iterative, allowing for reassessment as the situation evolves and new information becomes available, always with patient safety as the primary driver. Question 14. Quality control measures reveal that a significant number of medication administrations in the inpatient unit are not being documented in the electronic health record (EHR) within the required timeframe, leading to potential discrepancies in patient medication histories and treatment plans. As the Certified Patient Safety Officer, CPSO, which of the following approaches best aligns with Centers for Medicare and Medicaid Services, CMS, regulations for optimizing this patient safety process? Option A. Immediately issue disciplinary warnings to all nursing staff involved in the unit for failing to adhere to documentation policies. Option B. Expedite the medication administration process to allow more time for documentation later, prioritizing throughput over immediate record accuracy. Option C. Conduct a root cause analysis to identify systemic factors contributing to the documentation delays and implement targeted process improvements based on findings. Option D. Reiterate the existing documentation policy to all staff and emphasize the importance of timely entry without investigating the underlying reasons for non-compliance. The correct answer is C. Conduct a root cause analysis to identify systemic factors contributing to the documentation delays and implement targeted process improvements based on findings. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified patient safety officer, CPSO, to navigate the complex interplay between immediate operational needs and the overarching regulatory mandate of the Centers for Medicare and Medicaid Services, CMS. The pressure to maintain service delivery while ensuring strict adherence to patient safety regulation, particularly those concerning medication administration, demands careful judgment and a robust understanding of CMS requirements. The CPSO must balance the urgency of the situation with the non-negotiable standards for patient care. Correct approach analysis. The correct approach involves a systematic review of the medication administration process, focusing on identifying the root cause of the observed deviations from CMS standards. This approach is right because it directly addresses the underlying systemic issues that led to the quality control findings. CMS regulations, such as those found in the Conditions of Participation, COPS, for hospitals and other healthcare facilities, emphasize the importance of robust policies and procedures for medication management to ensure patient safety. A root cause analysis, RCA, is a recognized methodology for process optimization that aligns with CMS's expectation for continuous quality improvement and patient safety. By investigating the why behind the deviations, the CPSO can implement targeted, sustainable solutions that prevent recurrence and ensure compliance with federal patient safety mandates. Incorrect approaches analysis. One incorrect approach involves immediately implementing punitive measures against the staff involved without a thorough investigation. This fails to address the systemic issues that likely contributed to the deviations. CMS regulations focus on system improvements rather than individual blame as the primary driver for patient safety enhancement. Such an approach could foster a culture of fear, discouraging reporting of errors or near misses, which is counterproductive to patient safety goals and CMS's emphasis on a just culture. Another incorrect approach is to simply reinforce existing policies without investigating the reasons for non-adherence. This is insufficient because it assumes the policies themselves are adequate and that staff are intentionally disregarding them. CMS expects healthcare organizations to proactively identify and mitigate risks. If existing policies are not being followed, it suggests a breakdown in training, communication, resources, or the policies themselves may be impractical or unclear. A superficial reinforcement does not optimize the process or guarantee future compliance. A third incorrect approach is to prioritize the immediate resumption of the previous workflow without addressing the identified safety concerns. This is a direct violation of CMS's patient safety requirements. CMS mandates that healthcare providers maintain a safe environment and adhere to established protocols designed to prevent harm. Ignoring identified deviations from these protocols, even under pressure, creates an unacceptable risk to patients and demonstrates a failure to uphold the core responsibilities of a healthcare organization under federal regulation. Professional reasoning. Professionals in this situation should employ a structured problem-solving framework. First, acknowledge and document the quality control findings. Second, initiate a formal root cause analysis to understand the contributing factors. Third, engage relevant stakeholders, including frontline staff, to gather comprehensive information. Fourth, develop and implement evidence-based interventions to address the identified root causes. Fifth, monitor the effectiveness of these interventions through ongoing quality control and data analysis. Finally, ensure all actions are documented and aligned with CMS conditions of participation and other applicable patient safety guidelines. This systematic, data-driven, and patient-centered approach ensures compliance and promotes a culture of continuous improvement. Question 15. Comparative studies suggest that while failure mode and effects analysis, FME, is a robust tool for proactive patient safety, its implementation can be hindered by perceived resource limitations. As a certified patient safety officer, CPSO, in a U.S.-based healthcare organization, you have conducted an FME that identified a high-risk failure mode in medication administration. The clinical team responsible for this process acknowledges the potential risk, but expresses significant concerns about the resources, staffing, and technology required to implement the recommended corrective actions. Which of the following approaches best aligns with U.S. patient safety regulatory frameworks and ethical obligations? Option A. Initiate a collaborative reevaluation of the FME findings with the clinical team and relevant leadership to prioritize corrective actions based on risk reduction and feasibility, developing a phased implementation plan that addresses the most critical risks first while exploring resource optimization strategies. Option B. Mandate the immediate implementation of all FME-recommended corrective actions, overriding the clinical team's concerns about resource constraints to ensure absolute compliance with identified safety risks. Option C. Assign the responsibility for resolving the FME findings solely to the clinical team, providing them with the FME report and expecting them to manage the implementation within their existing resource limitations. Option D. Defer the implementation of the FME recommendations until such time as the organization can fully allocate the necessary resources, as identified by the clinical team, to avoid compromising existing operational demands. The correct answer is A. Initiate a collaborative reevaluation of the FME findings with the clinical team and relevant leadership to prioritize corrective actions based on risk reduction and feasibility, developing a phased implementation plan that addresses the most critical risks first, while exploring resource optimization strategies. Explanation. This scenario is professionally challenging because it requires a certified patient safety officer, CPSO, to navigate a situation where a critical process improvement identified through failure mode and effects analysis, FME, is being met with resistance due to perceived resource constraints. The CPSO must balance the imperative of patient safety, as mandated by regulatory frameworks, with the practical realities of organizational operations. The challenge lies in ensuring that the FME findings are not dismissed, but are addressed through a structured, evidence-based approach that respects both patient well-being and organizational limitations. Careful judgment is required to advocate for necessary changes without alienating stakeholders or creating an unsustainable operational burden. The correct approach involves a systematic reevaluation of the FME findings, focusing on the severity, occurrence, and detection of the identified failure modes, and then collaboratively developing a phased implementation plan for corrective actions. This approach is correct because it directly addresses the core purpose of FME, to proactively identify potential failures and implement preventative measures. Regulatory frameworks, such as those governing patient safety in the U.S., e.g., Joint Commission Standards, CMS conditions of participation, emphasize a proactive and systematic approach to risk management and quality improvement. By engaging stakeholders in a reevaluation and phased implementation, the CPSO demonstrates adherence to principles of continuous quality improvement and patient-centered care, which are foundational to patient safety regulations. This method ensures that patient safety remains paramount while acknowledging and seeking to mitigate resource concerns through strategic planning and prioritization. An incorrect approach would be to dismiss the FME findings outright due to the initial resistance, citing resource limitations without further investigation. This fails to uphold the regulatory obligation to proactively manage patient safety risks. Regulatory bodies expect organizations to investigate identified risks and implement appropriate mitigation strategies, not to ignore them based on initial perceived barriers. Another incorrect approach would be to proceed with the full implementation of all recommended FME actions immediately, without further consultation or consideration of the stated resource constraints. While this prioritizes safety, it may be operationally unsustainable and could lead to burnout or other unintended negative consequences, potentially undermining the long-term effectiveness of the safety initiative and violating principles of efficient resource allocation, which, while not directly a patient safety regulation, is an implicit expectation of responsible organizational management. A third incorrect approach would be to delegate the resolution of the FME findings solely to the department experiencing resource constraints, without providing adequate support or oversight. This abdicates the CPSO responsibility to ensure that patient safety is systematically addressed across the organization, and fails to leverage the expertise and authority of the patient safety role to facilitate necessary change. The professional reasoning framework for this situation involves a cyclical process of risk identification (FME), assessment, reevaluation of findings and resource impact, planning, collaborative development of phased implementation, executing planned actions, and monitoring, evaluating effectiveness and making adjustments. The CPSO should act as a facilitator and advocate, using data from the FME to support recommendations, engaging in open communication with all stakeholders, and seeking solutions that are both effective for patient safety and feasible within the organizational context. This involves understanding the regulatory landscape, ethical obligations to patients, and the operational realities of the healthcare environment. Question 16. System analysis indicates that a healthcare organization is seeking to enhance its patient safety initiatives by actively involving patients and their families in identifying and reporting potential safety concerns. To achieve this, the organization is considering several approaches for collecting feedback. Which of the following approaches best aligns with U.S. regulatory frameworks and ethical principles for patient and family engagement in safety? Option A. Implement a mandatory online portal where patients and families must register with their full demographic information and detailed medical history before submitting any safety feedback. Option B. Develop a comprehensive patient and family engagement program that includes clear communication about the purpose of feedback collection, the types of information sought, how it will be used to improve safety, and explicit consent processes that address confidentiality and anonymity. Option C. Place anonymous suggestion boxes throughout the facility for patients and families to drop in any safety-related comments they wish to share, without any further explanation or follow-up. Option D. Focus exclusively on collecting testimonials and positive experiences from patients and families to highlight the organization's safety successes, while not actively soliciting or addressing reported concerns. Correct answer is B. Develop a comprehensive patient and family engagement program that includes clear communication about the purpose of feedback collection, the types of information sought, how it will be used to improve safety, and explicit consent processes that address confidentiality and anonymity. Explanation. Scenario analysis. This scenario presents a common challenge in patient safety. balancing the desire for robust data collection with the imperative to respect patient autonomy and privacy. A certified patient safety officer, CPSO, must navigate the complexities of engaging patients and families in safety initiatives while adhering to strict regulatory frameworks. The professional challenge lies in designing engagement strategies that are both effective in identifying potential safety risks and compliant with privacy laws and ethical guidelines, ensuring that patients feel empowered rather than scrutinized. Correct approach analysis. The correct approach involves developing a structured program that clearly outlines the purpose of patient and family feedback, the types of information being collected, how it will be used to improve safety, and the mechanisms for ensuring confidentiality and anonymity where appropriate. This aligns with the principles of informed consent and patient rights, which are foundational in healthcare regulations. Specifically, in the U.S. context, this approach is supported by regulations such as the Health Insurance Portability and Accountability Act, HIPAA, which mandates patient privacy, and the Affordable Care Act, ACA, which promotes patient engagement in their care and in quality improvement initiatives. Ethical guidelines also emphasize transparency and respect for individuals. By providing clear information and obtaining consent, the organization builds trust and encourages genuine participation, leading to more accurate and actionable safety insights. Incorrect approaches analysis. An approach that involves passively collecting patient feedback through general comment boxes without clear guidelines on data usage or privacy protections fails to meet regulatory requirements for informed consent and data security. This could lead to breaches of patient confidentiality and a lack of trust, undermining the safety program. Another incorrect approach would be to implement a mandatory, detailed patient reporting system that requires extensive personal information without adequately explaining the necessity or the safeguards in place. This could be perceived as intrusive, violating patient privacy rights and potentially deterring participation, thereby compromising the quality of safety data obtained. Finally, an approach that focuses solely on collecting positive feedback to showcase organizational performance, while ignoring or downplaying negative safety concerns raised by patients and families, is ethically unsound and fails to address actual safety risks. This approach undermines the core purpose of patient safety initiatives, which is to identify and mitigate harm, and is contrary to the spirit of continuous improvement mandated by regulatory bodies. Professional reasoning. Professionals in patient safety must adopt a proactive and transparent approach to patient and family engagement. The decision-making process should begin with a thorough understanding of applicable regulations, e.g., HIPAA, ACA in the U.S., and ethical principles. This involves designing engagement strategies that are built on a foundation of trust, informed consent, and respect for privacy. When developing feedback mechanisms, it is crucial to clearly communicate the purpose of data collection, how the data will be used, and the measures taken to protect patient information. Regular review and refinement of these processes, based on patient feedback and regulatory updates, are essential for maintaining an effective and compliant patient safety program. Question 17. Investigation of a recent leadership walk-rounds revealed several instances where sterile processing protocols for surgical instruments were not being consistently followed by frontline staff, posing a potential risk to patient safety. The CPSO observed these deviations, but noted that the staff seemed hesitant to formally report them, citing concerns about being blamed. What is the most appropriate and professionally responsible course of action for the CPSO? Option A. Advise the frontline staff to be more diligent and remind them of the importance of following protocols, assuming they will self-correct. Option B. Provide direct, on-the-spot instructions to the frontline staff on how to correct their practices during the walk-rounds. Option C. Immediately report the findings directly to the Chief Executive Officer without involving any intermediate reporting structures. Option D. Document the observed deviations and initiate the organization's formal incident reporting process for investigation and resolution. The correct answer is D. Document the observed deviations and initiate the organization's formal incident reporting process for investigation and resolution. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Patient Safety Officer, CPSO, to navigate a situation where observed safety concerns during a leadership walk-rounds are not being adequately addressed by frontline staff, potentially due to perceived lack of authority or understanding of the reporting process. The CISO must balance the need for immediate action with established organizational protocols and the importance of fostering a culture of open reporting and continuous improvement. The challenge lies in ensuring accountability without undermining staff morale or creating a punitive environment. Correct approach analysis. The correct approach involves the CISO directly documenting the observed safety concerns and initiating the formal organizational incident reporting process, as mandated by patient safety regulations and best practices. This ensures that the issues are officially recorded, investigated, and addressed through established quality improvement channels. This aligns with the principles of proactive risk identification and management, a cornerstone of patient safety frameworks that emphasize systematic analysis and resolution of potential harm. The CISO role is to facilitate this process, ensuring that leadership is aware and that appropriate actions are taken, thereby upholding the organization's commitment to patient safety as outlined in regulatory guidelines. Incorrect approach is analysis. An incorrect approach would be to dismiss the observations as minor or to rely solely on informal verbal communication with the frontline staff. This fails to create a documented record of the safety concerns, which is essential for tracking, analysis, and accountability. It bypasses the established reporting mechanisms designed to ensure thorough investigation and appropriate corrective actions, potentially leaving patient safety risks unaddressed. Another incorrect approach would be to immediately escalate the issue to senior executive leadership without first following the established incident reporting protocol. A leadership awareness is important. Bypassing the standard process can disrupt workflow, create unnecessary alarm, and undermine the authority and responsibility of departmental managers and quality improvement teams. It also fails to leverage the structured problem-solving mechanisms in place. A third incorrect approach would be to directly instruct the frontline staff on how to fix the observed issues without involving their immediate supervisors or the appropriate safety committees. While well-intentioned, this can undermine the chain of command, create confusion about roles and responsibilities, and may not address the root cause of the problem. It also misses the opportunity to reinforce the importance of the formal reporting and problem-solving processes. Professional reasoning. Professionals should approach such situations by adhering to established organizational policies and regulatory requirements for incident reporting and patient safety. The decision-making process should involve 1. Objective observation and documentation of safety concerns. 2. Initiation of the formal incident reporting system to ensure proper tracking and investigation. 3. Communication with relevant departmental leadership and safety committees to facilitate resolution. 4. Monitoring the progress of corrective actions to ensure effectiveness and prevent recurrence. This systematic approach ensures that patient safety is prioritized through a structured and accountable process. Question 18. The risk matrix shows a moderate to high risk associated with the administration of a specific class of high-alert medications on a particular inpatient unit. The identified contributing factors include a complex administration protocol and a perceived lack of consistent staff awareness regarding potential adverse events. What is the most appropriate and comprehensive approach to mitigate this identified risk? Option A. Update the electronic health record system to include more prominent alerts for these medications, without altering current staff training or administration protocols. Option B. Mandate a single pharmacist to conduct a comprehensive review of every medication order for this class of drugs before it is dispensed to the unit. Option C. Implement a multifaceted strategy including enhanced staff education on the specific risks and revised administration procedures, coupled with the implementation of a double-check system for high-alert medications. Option D. Immediately restrict the use of all high-alert medications within this class on the unit, requiring physician approval for each individual dose. The correct answer is C. Implement a multifaceted strategy including enhanced staff education on the specific risks and revised administration procedures, coupled with the implementation of a double-check system for high-alert medications. Explanation. Scenario analysis. This scenario presents a common implementation challenge in patient safety, balancing the need for robust medication safety protocols with the practical realities of workflow and staff capacity. The risk matrix highlights a moderate to high risk associated with a specific medication administration process, indicating a potential for harm. The professional challenge lies in selecting the most effective and sustainable intervention that addresses the identified risk without causing undue disruption or creating new safety concerns. This requires a deep understanding of medication safety principles, regulatory expectations, and the operational environment. Correct approach analysis. The correct approach involves a multifaceted strategy that includes enhanced staff education on the specific risks and revised administration procedures, coupled with the implementation of a double-check system for high-risk medications. This is the most effective strategy because it directly addresses the root causes identified by the risk matrix, potential for error due to complexity or lack of awareness. Enhanced education reinforces understanding of critical steps and potential pitfalls, while a double-check system provides a crucial safety net for high-risk medications, aligning with established best practices in medication safety. Regulatory frameworks, such as those overseen by the U.S. Food and Drug Administration, FDA, and the Joint Commission, emphasize a proactive approach to medication safety, including education, standardized procedures, and verification processes to minimize medication errors. This approach is ethically sound as it prioritizes patient well-being by implementing evidence-based safety measures. Incorrect approaches analysis. Implementing a blanket restriction on all high-risk medications for a specific unit without further investigation or targeted interventions is an overly broad and potentially harmful approach. This could lead to delays in necessary patient care and may not address the underlying systemic issues contributing to the risk. It fails to leverage educational opportunities and may create a false sense of security while leaving other vulnerabilities unaddressed. Relying solely on a single pharmacist review of all medication orders for the unit without considering the nursing administration process is an incomplete solution. While pharmacist oversight is critical, medication errors can occur at multiple points in the medication use process, including during administration by nursing staff. This approach neglects the direct patient interaction and the administration phase where many errors manifest, focusing exclusively on updating the electronic health record (EHR) system with new alerts without accompanying staff education or procedural changes is insufficient. While EHR alerts can be valuable, they are only effective if staff are aware of them, understand their significance, and are trained on how to respond appropriately. Without this, alerts can be overridden or ignored, rendering them ineffective and potentially creating a new risk if staff become desensitized to them. Professional reasoning. Professionals should approach such challenges by first thoroughly analyzing the risk matrix and the underlying contributing factors. This involves a systematic review of the medication use process, including direct observation and staff interviews. The chosen intervention should be evidence-based, proportionate to the identified risk, and integrated into existing workflows where possible. A phased implementation with clear communication, robust education, and ongoing monitoring for effectiveness and unintended consequences is crucial. This decision-making process aligns with the principles of continuous quality improvement and patient-centered care mandated by regulatory bodies and ethical professional standards. Question 19. Operational review demonstrates a need to systematically identify potential failures in the medication administration process and their potential impact on patient safety before any adverse events occur. Which proactive risk assessment technique is most appropriate for this objective, aligning with established patient safety principles and regulatory expectations for preventing harm? Option A. Root cause analysis (RCA). Option B. Incident reporting system analysis. Option C. Simple checklist review. Option D. Failure mode and effects analysis (FME). The correct answer is D. Failure mode and effects analysis (FME). Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Patient Safety Officer (CPSO) to identify and implement a proactive risk assessment technique that aligns with the specific regulatory framework governing patient safety in the United States. The challenge lies in selecting the most appropriate method from several plausible options, each with its own strengths and weaknesses, while ensuring compliance with federal mandates and best practices for patient safety. The CPSO must demonstrate a deep understanding of how different proactive risk assessment tools contribute to preventing adverse events, rather than merely reacting to them. Correct approach analysis. The correct approach involves utilizing a failure mode and effects analysis (FME). This method is a systematic, proactive, and team-oriented approach to identifying potential failure modes in a process and determining their effects and potential causes. In the context of patient safety, FME allows for the identification of potential hazards in clinical processes before they lead to patient harm. Regulatory frameworks in the U.S., such as those promoted by the Joint Commission and the Agency for Healthcare Research and Quality, AHQ, strongly advocate for proactive risk assessment methodologies like FME as a cornerstone of a robust patient safety program. FME directly addresses the requirement to anticipate and mitigate risks, aligning with the overarching goal of preventing adverse events and improving patient outcomes, which is a core ethical and regulatory imperative for healthcare organizations. Incorrect approaches analysis. An approach focusing solely on retrospective root cause analysis, RCA, is incorrect because RCA is a reactive method. It investigates adverse events asterisk after asterisk they have occurred to determine their causes, rather than proactively identifying potential failures. While RCA is a valuable tool for learning from past mistakes, it does not fulfill the requirement for a proactive risk assessment technique. Relying exclusively on incident reporting systems without a structured proactive analysis framework is also insufficient. While incident reporting is crucial for identifying actual events, it often lacks the systematic, forward-looking analysis needed to predict and prevent potential failures before they manifest. A simple checklist review, without the in-depth analysis of potential failure modes and their consequences inherent in FME, may not uncover subtle but significant risks within complex patient care processes. It can be a component of a larger assessment, but is not a comprehensive proactive risk assessment technique on its own. Professional reasoning. Professionals in patient safety must adopt a mindset that prioritizes prevention over reaction. When faced with the need for proactive risk assessment, the decision-making process should involve 1. Understanding the specific regulatory requirements and accreditation standards applicable to the organization, particularly those emphasizing proactive risk identification. 2. Evaluating available proactive risk assessment methodologies, e.g., FME, hazard analysis, proactive risk assessment. 3. Selecting the method that best fits the complexity of the process being assessed, the available resources, and the organization's safety culture. 4. Ensuring the chosen method involves multidisciplinary team participation to capture diverse perspectives and potential failure points. 5. Integrating the findings from the proactive assessment into process improvement initiatives and ongoing monitoring. Question 20. The review process indicates a delay in diagnosis for a patient presenting with acute symptoms, which led to a suboptimal treatment initiation. While the patient's condition has since stabilized and is expected to fully recover, the initial diagnostic pathway was significantly longer than anticipated and involved multiple consultations. As the certified patient safety officer, what is the most appropriate immediate course of action to ensure patient safety and regulatory compliance within the U.S. healthcare framework? Option A. Immediately issue a formal reprimand to the primary physician involved in the patient's care for the diagnostic delay, as per hospital policy on performance deficiencies. Option B. Escalate the matter to the state medical board for an immediate review of the physician's competency, given the potential for harm. Option C. Document the event in the patient's chart as a near miss due to the eventual positive outcome and consider it a closed case, as no permanent harm occurred. Option D. Initiate a formal root cause analysis, RCA, to systematically investigate the diagnostic process, identify contributing factors, and develop recommendations for system improvements, while ensuring all patient safety information is handled in accordance with the Patient Safety and Quality Improvement Act of 2005. The correct answer is D. Initiate a formal root cause analysis, RCA, to systematically investigate the diagnostic process, identify contributing factors, and develop recommendations for system improvements, while ensuring all patient safety information is handled in accordance with the Patient Safety and Quality Improvement Act of 2005. Explanation. This scenario is professionally challenging because it requires the Certified Patient Safety Officer, CPSO, to navigate a complex situation involving potential diagnostic error, patient harm, and the need to uphold organizational policies while ensuring patient safety. The CPSO must balance the immediate need to address the patient's condition with the long-term imperative of learning from the event to prevent recurrence. Careful judgment is required to determine the most appropriate course of action that aligns with regulatory requirements and ethical principles of patient care and reporting. The correct approach involves a thorough, systematic investigation of the diagnostic process, focusing on identifying contributing factors without assigning blame. This aligns with the principles of just culture, which encourages reporting of errors and near misses to facilitate learning and system improvement, rather than punitive action. Specifically, under U.S. federal regulations governing patient safety, such as those related to the Patient Safety and Quality Improvement Act of 2005, PSKIA, and its implementing regulations, 42 CFR Part 42, the focus is on improving patient care by encouraging the reporting and analysis of patient safety events. A systematic review, including root cause analysis, RCA, or a similar structured approach, is mandated or strongly encouraged to understand the underlying systemic issues that may have contributed to the diagnostic delay or error. This approach respects the confidentiality protections offered by PSKIA for voluntarily reported patient safety information, fostering an environment where staff feel safe to report. An incorrect approach that focuses solely on immediate disciplinary action against the clinician without a comprehensive investigation fails to address the systemic issues that may have led to the diagnostic error. This punitive approach can stifle reporting, create a culture of fear, and prevent the organization from learning and implementing necessary system-wide improvements. It directly contradicts the spirit and intent of patient safety legislation, which prioritizes learning and prevention over blame. Another incorrect approach that involves ignoring the event or downplaying its significance due to the patient's eventual recovery is also professionally unacceptable. Patient safety is not solely defined by the outcome. It encompasses the processes and systems in place to prevent harm. A diagnostic delay or error, even if ultimately corrected without lasting harm, represents a failure in the safety system and a missed opportunity for improvement. Failing to investigate such events violates the ethical obligation to continuously improve patient care and can lead to future, potentially more severe, adverse events. The professional decision-making process for similar situations should involve 1. Immediate patient care stabilization and safety. 2. Timely and accurate reporting of the event according to organizational policy and regulatory requirements. 3. Initiation of a structured patient safety investigation, e.g., RCA, to identify contributing factors, focusing on system issues rather than individual blame. 4. Implementation of evidence-based recommendations for system improvement. 5. Monitoring the effectiveness of implemented changes. 6. Communicating lessons learned to relevant staff. This process is guided by the principles of just culture, regulatory mandates for patient safety improvement, and ethical obligations to provide safe and effective care.